Attention, please.
Hello, everyone, and welcome to The Daily Dose with Doctors Ken and Ten. Today we have Lia Watson joining us for Mental Health Awareness Month. She is a licensed and certified marriage and family specialist. You can find her at Liaison Counseling Services in the greater Houston area. Give us kind of a rundown of all the other things that you do besides marriage and family therapy.
Definitely. Well, like you said, I'm a licensed professional counselor, and I'm also a counseling supervisor as well. My specialty is working with minority women who are dealing with depression, anxiety, work-to-life balance, day-to-day stress. I mean, y'all are women, y'all are moms, y'all know how much we kind of deal with every day trying to maintain all of those things and stay sane.
Yeah, absolutely. So I have a question. So coming off of this year in particular, there's been a lot of stressors, not just with the pandemic, but we had the protesting with police brutality. Mm-hmm. We've had, economic declines, people losing jobs. So I want to know, in all of this, I'm sure you're seeing a lot of anxiety and depression, or at least I'm assuming you are, just from the
definitely with people with COVID, with people being isolated, you have to deal with some of your own emotions and things like that. So definitely.
So what would you say to people in terms of like how are they supposed to self-diagnose, or if they're feeling a certain kind of way, should they just call their physician? Should they look for a psychiatrist?
I would definitely say do not self-diagnose. Y'all as doctors know, and now we have all these things on the internet. You're going to get on the internet and self-diagnose the wrong diagnosis. So I definitely say seek a professional. I think your doctor is a great starting point, because a lot of the times whenever we're going through mental health, we don't know that exactly we're dealing with depression. It might be, hey, doctor, I'm having trouble sleeping. My appetite's been gone. So a lot of those symptoms the symptoms of depression, we notice those more than actually the diagnosis. So I think you're going to your primary care doctor would be a very great start. And I've noticed that a lot of physicians, thankfully, are now resourcing out to therapists before prescribing medication, because a lot of people think that that's the only option whenever you are having these things. So a lot of doctors have been referring out to mental health professionals, especially during this time of COVID.
What kind of symptoms should people be looking for? I mean, because a lot of those symptoms that you just said sound like, I don't know, GI upset, acid reflux.
Very true.
How do you know that it's anxiety or depression?
Whenever it becomes to like it's impacting your daily life, when it kind of makes things where it becomes debilitating. I'm unable to get up for work. I'm not able to function and have enough energy to care for my kids. I'm not bathing on the regular. Like whenever it becomes to distracting to your daily routine.
You already gave us the symptoms of what to look for. And you tell people out there to go see your doctor. Well, the problem is, Lia, is that they can't get in to see the doctor. We're booked.
This is true. What
are the other resources other than a physician for people to reach out, to call for help? Because I see patients at 3 months, they're in depression.
Definitely. I would tell people to at least go reach out to a counselor. There's so many platforms that you could access. If one counselor doesn't have an opening, there's a lot of us out there. You can check like Psychology Today, Therapy for Black Girls, Taraji's Foundation, Boris P. Henson. They have a search engine as well where you can search for you can actually search for psychiatrists, social workers, and counselors. So I would say using some of these platforms and reaching out to them.
How do you know at what point to go to your primary or a psychiatrist or a counselor? Because I honestly, to be honest, I don't know like what a therapist versus a counselor versus a psychiatrist, like which one do you use? How do you know what to choose?
Therapist and counselor are pretty synonymous. You can use those in whichever way that you want. Psychiatrists, they're more for prescribing medications. They don't really do a lot of talk therapy. It's kind of like the first session is going to be getting a lot of your medical history and background, and then consulting about medication. Versus a therapist, we're going to talk about kind of your problems, come up with an action plan of how to deal and cope with them from there. So I guess how you determine which one would be best for you is kind of how big your symptoms are. Again, if it's to the point where I can't get up, I'm having low energy, a psychiatrist might be a good start for you because you might need medication. Or again, that's why sometimes I do refer to your primary care doctor, because you might just need to do some blood work. Maybe you're fatigued because you have low iron or something like that. So I think that kind of whatever your stressor is if it's a physical ailment at that time or whatever it is, or if it's just like more of an emotional burden, then I would suggest going to a therapist or a counselor.
Lia, so you're talking about cognitive therapy. So can you tell everybody what that means, the definition, and who actually offers cognitive therapy?
Okay. It's also always known as CBT, which stands for cognitive behavioral therapy. What that means is that believe that a lot of your thoughts control your mood, your reaction, and your interactions. So what we would do during that time is actually break down your thoughts and see how they're impacting you. Prime example, if I'm in traffic and I'm sitting there frustrated and things like that, what are you thinking that's making you more frustrated? Is like, dang, I'm going to be late for my destination. So I think that a lot of your thoughts can control how you perceive a situation and how you go into it or interact. If you go into it like, okay, yes, traffic's frustrating, I can't control it, but let me focus on the things that I can control. Let me try to have a positive attitude or outlook on things. It's kind of like the saying of like looking at the glass, is it half full or half empty?
Is that the main modality that you use as a therapist?
Yes, that, and also person-centered, because of the fact that I like to go based on the client because they're the expert in your life. You've been through the experience and you also have to deal with your actions and consequences of whatever we determine. So I also believe in person-centered. Those are the two main modalities that I personally use in my practice. Because I always try to tell clients that basically I'm the co-pilot. Like, you're going to kind of guide this. So it's all, the whole process is centered around you, what you want to accomplish, and your thoughts as well.
So what do you say to people? Because there is a stigma of going to a therapist. I think across the board, people have this thing about going to a therapist. They think that it makes them weak or makes them crazy. What do you tell people in terms of how to break that stigma, how to break past it and go get help when you need it?
Definitely. I think the first thing is, again, platforms like this and opening up the conversation for it and like debunking some of those myths. Because again, people think I have to go to counseling like if I'm crazy, if I'm suicidal, if I'm seeing things. And that's not really the only time that you need to seek counseling. Just like you go into your doctor to get a physical to just make sure you're good, you should do the same with your mental, to just check in, because life is always coming. Who was prepared for a national pandemic? We all have work stress. So how do we know to mentally prepare for that? I know a lot of people, because I was looking at some of the statistics, mental health rates increased during COVID. So I think it's, again, people kind of acknowledging and having conversations about these things to normalize it. And then also,
do you think then that people should go to counseling regularly? Do you think, like, instead of waiting until there's a problem, do you think that they should just go as if it were any other, yearly exam, or you go?
Definitely. Yes, I would definitely recommend it, because give me a person who says that they've never dealt with stress.
Yeah.
I don't know anybody who can say that
you're a liar.
I was about to say, please, because I would love to know how they live. I want to take notes, follow them, but no, everybody deals with stress. So I definitely believe that it's good to check in. And also the reason why I think is to have somebody outside and unbiased, especially to come and check in as well, because sometimes we're so much in our thoughts, or so everybody's enmeshed in our situation. Sometimes it's hard to see a different perspective.
Yeah, my husband and I, we do marriage therapy. You know what? He really didn't want to do it at first, I think, because there's a stigma that, okay, something's wrong, we're crazy, blah, 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 or I can fix it. Like, we don't need anybody else. All we got to do is talk.
But we're also stuck in our ways or in our opinions.
We don't really talk, right? When you have issues, I think a lot of couples in particular just brush them under the rug.
And, because we're busy.
Yeah. Right. You'll forget it. We play that he'll forget about it, she'll forget about it game.
And we'll just move on.
Yeah, and that's our therapy. But I think now that we're doing it, I can honestly say, like, our marriage is so much better. Knock on wood.
Okay.
Because we learned it's not about someone telling you what to do or telling you how to fix your problem. They're teaching you how to communicate in life.
Right.
Once you did this and it got exponentially better, now I see, like, wow, we were missing out on so much.
And I think that y'all touched on good points, because small thing, I am actually a fan of the show that y'all are both on. So to use kind of y'all as, like, per se an example, a lot y'all, when everybody goes through life changes. I know for you, Dr. King, you became a first-time mom. That changes the dynamic of your work life, your friendships, your marriage. So as you're going through some of these transitions, these aren't things that you're used to. So you need somebody to kind of talk through, or to kind of be that mutual unbiased person, or even for you, kind of Dr. Tin, transitioning from being away from your kids for work. So, I mean, that changes your parenting dynamics, your relationship dynamics. And these are kind of those life things that I was talking about that kind of come at us that we're not always prepared for. And to just kind of have an unbiased, confidential person to help you navigate through some of these situations is what I think the benefit of therapy is. And that kind of circles back to your question of, like, should it be kind of just regularly or routine? Yes, because we just kind of need to check in and every time, just maybe even to unload.
Yeah, I want to ask you, do you see a therapist?
Yes, I definitely do. I try to check in at least like monthly because, again, I'm a mom. I have relationships with family, friends, finding that balance. So, of course, somebody to just check in, and then also just myself, putting pressure on myself for my career, trying to get to where I want to be. So somebody to just kind of like, "Ooh, look," to check in what's going
on. A lot
on.
on your shoulders, especially being a therapist. So I would imagine that could be a big stressor for you as well.
Definitely. But with that being said, one thing I advocate to all my clients, and it's always all over my social media, is self-care. And for a lot of times, I think people think self-care has to be like, oh my God, a spa day or a vacation. Self-care for me is like after 5 o'clock, I'm not answering my business phone. The weekends, I don't even see that phone. Like it's nowhere near there. I actually try to take my Sundays to get completely off social media, but I try to practice what I preach.
Yeah, I saw on your Instagram, your emotional health tip was say no to the things you don't want to do.
I think that, again, people underestimate like how far we extend ourselves, especially as like women. We overextend ourselves for our family, our friends, our kids, our spouses, and oftentimes we forget about self.
Have you noticed that for women, you see them more often, or they have certain complaints and certain issues that, if you tell us now, maybe we could all benefit from because we can relate to it. Like, oh, okay.
I definitely think like us overextending ourselves. And then also too, I think it's, again, our thoughts, because of unfortunately today, social media, we're always comparing ourselves, our expectations. You know how many women I have come in feeling like they're not doing enough or not doing what they're supposed to do. I'm like, girl, you got a degree, you a nurse, you taking care of your kids. They ain't died yet. They survived through COVID. Like, just remember that you're running your race and do what you can do in this season.
I have to talk about the obvious question. Is money. So a couple of my friends, they're licensed marriage family therapists, and they're making $200 to $300 an hour. That's expensive.
It is. But I think that kind of goes to having a therapist that fits you. And if we want to have for me, a transparent moment, I see a lot of other therapists that do that. They accept cash only. They don't do insurance. So part of me is like, man, they're making all this bank. But for me, my ideal client is a minority woman who's working a 9 to 5. So for me personally, I accept insurance. And I think what a lot of people do not know is that the insurance that you're paying for, it includes mental health services. Just like you have a small copay whenever you go to the doctor, the same thing applies for mental health services. A lot of people who are working with these corporations, they don't know that there's a such thing as an EAP, an employee assistance program, where you could possibly get counseling absolutely for free.
Wow. Resources.
Yeah. And even for some of those people who are charging cash, you can ask them, do they offer a sliding scale? Because a lot of them will see some clients at a discounted rate. And there's also websites like OpenPath, where you sign up for them and you can get a counselor that you can see as often as you want for only like $50 per session. And then also I know like Taraji, she has the Boris L. Hinton Foundation, where they actually have sponsored some counseling sessions for people as well, where you can get counseling absolutely free too. So I think that there are resources out there, but people just need to be more knowledgeable of them.
So let's just say it's just not on your budget. You don't have a job, right? Is there some things at home that they can do to bring down stress, or if they feel like they're getting depressed? Is there any like pick me ups, anything that
I always advocate for like journaling, use of positive affirmations? Because again, I think that a lot of us get so caught up in our heads. Like if I was in my bedroom right now, I have sticky notes everywhere, like telling me like, you got this, girl, some Bible verses. So things like that to keep yourself encouraged. Noon, I have my phone go off to just remind myself of identifying three things that you're grateful for, because in life, we're always going and going and going. So taking some of these small things and just like slowing down. Before I get out of my bed, I try to say 3 things that like I want to accomplish, or remind myself of like, hey, 3 things that I did accomplish. Because most of us, we getting up, we're going, we're anxious about what we need to do, what we didn't finish. Like I like to try to start my morning and my nights with gratitude. And I think that a lot of people don't understand how impactful that is. Or even small things, taking time in silence. It doesn't necessarily have to be like meditating, but meditating is awesome. But kind of just taking some time to yourself and reflecting and acknowledging the positive things about yourself.
Yeah, we are going to wrap this up. We're going to have you on again and talk about relationships.
Yes, please. I would love to.
You're definitely going to be our resource for mental health. But this is May, Mental Health Awareness. What are the 3 takeaway points that you want everybody to know?
one, don't be scared to ask for help. Let's normalizing asking for help, because that can help to take a lot of stress off us. It's okay to seek counseling. That doesn't mean that you're crazy or there's anything wrong with you. And then the third one would be like self-care. Make sure you're doing something to take care of yourself. And again, it doesn't have to be extravagant.
And where can our village find you?
You can find me on Instagram at Lia the Therapist. You can also follow my business on Facebook, Liaison Counseling Services. And also I'm on LinkedIn as well, under Aaliyah Watson.
Thank you, Lia, for joining us. Until next time, doses.
When they find out who did it.
And okay, you're gonna cancel it out.
I gotta redo that shit.